This video outlines the steps involved in performing a voiding trial with a suprapubic catheter for postoperative urogynecology patients. First, ensure that urine output has been adequate while the catheter has been to continuous drainage. If urine output is less than 30 milliliters per hour, contact the on-call urogynecology team. If urine output has been greater than 30 milliliters per hour, it is okay to begin the voiding trial. If vaginal packing is in place, remove it and document its removal in Cerner. To begin the trial, turn the flow to the collection tubing off by turning the stopcock counterclockwise so that the long arm is towards the patient. Disconnect extension collection tubing from the suprapubic catheter. Separate the suprapubic tube from the cath secure sticker and remove from the patient's skin gently. Wrap the stopcock with tissue or gauze to prevent it from pressing into the skin, and use the patient's underwear to hold the tube in place. Do not allow the tube to fall between the patient's legs. Place a toilet hat in the toilet and provide the patient with a post-void residual log sheet. Have the patient call for the nurse when they have the urge to spontaneously void or after 4 hours. Have the patient void in the toilet hat. Immediately after the void, have the patient check the post-void residual by emptying the suprapubic tube into the cylinder. Turn the stopcock 90 degrees to the blue cap. After the patient has completed this, turn the stopcock clockwise back towards the patient to close. Again, wrap with gauze or tissue and tuck it in the patient's underwear. Record the voided volume in the ins and outs under voided volume and the post-void residual from the suprapubic tube under suprapubic tube volume. Have the patient record these values on their post-void residual log sheet in addition to what is charted electronically. If patient has not voided within 4 hours, ask them to void to avoid bladder overdistension. If unable to void, have the patient empty their bladder with the suprapubic tube. Record voided volume as 0 and post-void residual as the suprapubic tube volume. The patient will likely be discharged with the suprapubic tube in place and be removed in the office when PVRs are less than 100 milliliters for every void for 24 hours. Upon discharge, please provide them with the post-void residual bladder log, toilet hat, and cylinder. Contact on service fellow via diagnotes with any questions.